now talking about COVID-19 and pregnancy, and I know this is something that Benson and Hilary touched upon in the previous session. So there are special codes which you use for COVID-19, which were created last year. Obviously, they didn't exist when ICD-10 was created because it's a new disease. So when you code death as pregnancy-related and COVID-related, you need to use both sets of guidance, the WHO application of ICD-10, ICD-10, and also this technical note. The links are on the slide, which explains how to code and report all COVID-19 deaths. So the one on the right isn't specific for pregnancy. And just to recap what it says in here and what I believe you've already covered, a death due to COVID-19 is a death resulting from a clinically compatible illness. It can be either a probable or a confirmed COVID-19 case, unless there's a clear alternative cause of death which can't be related to COVID disease. So, for example, a car accident. So the disease needs to be clinically compatible with COVID-19. In a setting where testing is not readily available, it is not necessary to have a positive COVID-19 test in order for the death to be classified as due to COVID-19. There are separate codes for indicating probable COVID-19, which come on a later slide. The other thing to note, which is becoming more important now as we're moving into the second year of the pandemic, is there should be no period of complete recovery between COVID-19. There should be no period of complete recovery from the illness and the death. So, for example, just because someone had a COVID-19 illness last year, perhaps it was last summer, doesn't mean that they then die many months later, that it's necessarily that you automatically record COVID-19 as death, as the cause of death. Some countries were doing this, particularly early on in the pandemic, because they were, systems were taking a while to get up and running. People started recording anything where the woman had tested or the person had tested positive for COVID-19 as a COVID-19 death. That's not the case. So there needs to be the clinically compatible illness, and there needs to be no period of recovery. So that's something to watch out for. So specifically with maternal, a woman who dies from the mutual aggravation of COVID-19 in pregnancy would be considered a group 7, an indirect maternal death. And the specific cause of death, it's called pregnancy complicated by COVID-19. And the category in which that falls under is 098.5, which its title in ICD-10 booklet is Other Viral Diseases Complicating Pregnancy, Childbirth, and the Puerperium. As is the case with all indirect maternal deaths, you use a double code. So there's the O code, which is at a broad level in this example, it's other viral diseases. And then you use a comma, and you would usually, if possible, write a second code which specifies the exact disease, the virus, or whatever that this particular death should be classified under, because the O code is often a bit broader because of the fact that we're capturing such a huge number of deaths within this category. So for COVID-19, it's 098.5, U07.1 if the COVID-19 was confirmed through a positive test from a lab. And if there wasn't an opportunity to do a lab test, then it's just probable or a suspected COVID-19 case without laboratory confirmation, you would code 0.2. But again, exactly the same as with the HIV/AIDS example that we discussed earlier. She could also die of a direct obstetric cause, so for example, obstetric hemorrhage, and you could code the COVID-19 as a contributing cause if that was relevant and applicable in that situation, but it wouldn't be a COVID death. It wouldn't be a death due to COVID. And similarly, a woman could have a car accident or so on, where she was both testing positive for COVID-19 and was pregnant, but she dies of an accident and it had nothing to do with either the pregnancy or the COVID-19. So the same principles apply. And this is an example of the death certificate correctly filled out, and this example is contained within the WHO guidance that I showed a couple of slides ago. A final note specifically, especially for those of you who were involved in data reporting outside your own facility, perhaps, is about maternal mortality during the COVID-19 pandemic. So we in WHOHQ get quite a lot of reports of maternal death where people are talking about death due to COVID-19, but when you read the vignette and you read the case history and what happened, the woman herself didn't necessarily have COVID-19. She didn't have the virus, but she died, for example, due to the disruption caused by the pandemic. So, for example, she may have been unable to access a health facility because of quarantine restrictions, or health care professionals may have been diverted to COVID wards. She may not have received normal quality care that she otherwise would have done because of the fact this pandemic exists. These deaths are incredibly important. And in fact, they likely will, although we don't know, we don't yet have the data, they likely will constitute a much bigger burden in terms of overall maternal mortality than those deaths where the woman had a virus. So they are really important deaths. However, it's really important not to report and code them on the death certificate as death due to COVID-19, because that has a specific meaning of where the woman had the virus and the virus interacted with her pregnancy status. So when we're reporting and monitoring on maternal mortality during this time and going forward, we're going to need to separate out those deaths which were due to service and care disruptions, and those which were due to the biological effects of the virus. And again, the reason we need to do this is, as we've discussed many times now, the so what differs, the what we do about it differs. So yeah, just a note on that. And sometimes it's also particularly confusing because pre-existing to the pandemic, we have this classification. We have this word that we use, indirect death. Some people, particularly laymen who don't work in maternal mortality, sometimes use the word colloquially to mean these deaths due to service disruptions, and then we need to be careful not to do that. So if someone is talking or presenting and they talk about indirect COVID death, make sure that you're all using the same language and the same terminology, and it's clear that whether we're talking about deaths where the woman had COVID-19 or whether they're kind of what we would normally call in epidemiology excess mortality, those due to service disruptions. One of the last things I wanted to say before we go and look at some more specific examples and scenarios was something important in ICD if you read it, is there are a lot of codes which they are part of ICD, but they don't usually lead to the death. So an example of that might be the anemia code that I discussed, that I mentioned earlier. And within the ICD-MM booklet, there's a huge annex, it's Annex B2, which contains a list of codes which normally should only be recorded in the contributing conditions section of the death certificate. It's very unlikely that they will be appropriate to use as the underlying cause of death. So to the extent possible, you should avoid using these as the underlying cause of death. There may be exceptions where it is appropriate, and if it is appropriate, then obviously you may do so. But if you find yourself wanting to do that, you should double check that you're following all the principles correctly, because it's unusual for them to be the true underlying cause of death. And it's a very long list, but examples, for example, sometimes people write twin pregnancy. Twin pregnancy doesn't cause the death. It can be a contributing condition, but something had to happen beyond the fact that the woman had a multiple gestation to cause the death. You don't in and of itself die because of the fact that you're pregnant with twins or triplets. Similarly, things like malnutrition, it can be a complicating factor. But again, it doesn't normally in and of itself cause the death. And there are also codes related to the infant. So for example, fetal distress and so on. The mother doesn't die because of fetal distress. The fetal distress may coexist, but it's not why the mother herself would die. So these are a list of links. I presume, are the slides going to be shared, Fatima, or we can send these around to everyone if not? But they're just some links showing you where you can go online. There's online training manuals with a specific chapter focused on the ICD-MM. there in the middle, and also the booklet, which I believe you've already been sent, and so on and so forth.